Hi, and welcome to A View from the Bed. This is a CHI St. Vincent podcast where we talk to real patients about their healthcare perspective. We know that your healthcare journey can be scary, so that's why we want to get their view on the good, the bad, and the ugly from diagnosis to recovery. Enjoy today's episode.
Hello, welcome to the podcast this month. As you can see, we got things going a little bit different. We've kind of flipped the script on its head a little bit. Bonnie, who is typically our host, is going to be the patient this week. So we appreciate her willingness to join us today. We're going to talk to Bonnie about some arrhythmia issues that she's had with her heart. So Bonnie, thanks.
Yeah. Hey, I am so excited to be the patient. And I do practice what I preach to you guys all the time. So thanks, Danny.
All right, Bonnie. So let's start at the beginning, which is usually a pretty good place to start. Tell us when you first started experiencing some issues with your heart, what was going on, and kind of the process you went through to figure out what was happening.
Well, it was kind of weird. So one day I was just doing grocery shopping at Walmart, of all places. And I'd went through most of my list, and I noticed that my heart started feeling like it was racing, which I've had an abnormal EKG for most of my life. So sometimes it'll race or flutter a little bit, but then it goes away. Well, this time it did not go away. And instead of stopping my grocery shopping, I finished my list and did self-checkout. And so, I was like, oh, it'll go away. And the fluttering just got more intense. And so by the time I got back to my house, it had been going on for almost an hour. So I phoned a friend who is a CV surgeon trained, and I said, hey, here's what's happening. And he said, you need to go to the ER. And, that's the last thing you want to hear is you want to go to the ER. Yeah. So I reluctantly did, and I'm really glad I did.
Yeah. So you say you had fluttering issues. Describe a little bit about how that feels for the people out there that may not have experienced this or may be experiencing it and, not sure what it is.
Yeah, so it almost kind of feels like your heart is hiccuping a little bit. And it really is too like the way a fish flops on the ground. That's exactly what it feels like. And so sometimes it can make you feel lightheaded, or it can even give you a sense of you're going to pass out. And then, like with mine, I almost felt like I couldn't catch my breath,
right?
Because it was just flopping and flipping so much.
So you get to the ER.
And
they check you out. And what happens then?
So they put me on a heart monitor, and instantly the nurse goes, oh, I can see that you're throwing PVCs, which is when your heart is actually going faster than it should. So it'll beat normally, and then all of a sudden it will skip a beat or throw an extra beat, which gives you that sensation of fluttering. And so instantaneously, they could tell something was going on. And which I'll be honest was a little validating, because that you don't feel right. But then to see it on the EKG was really kind of crazy, like to the point my sister even took a video of it. So
they say they see your arrhythmia. And what do they do there at the ER?
So they started a whole series of tests. They also called the cardiologist that was on call. And then they start asking me too about family history and lifestyle factors. I have a very strong family history of heart disease, heart-related disease at a very young age. And then also they started asking, do I drink a lot of caffeine? Do I drink energy drinks, which I don't? And when they eliminated the lifestyle factors, they started a series of tests. So they did blood tests. They did a CT scan of my heart and my chest. They did an echocardiogram, which is like an ultrasound of my heart. And they even went ahead and just did a generic chest x-ray to make sure I didn't have any bronchitis or any kind of infection that could cause some symptoms to happen.
So when you have an arrhythmia, typically I'm guessing the first step generally is they try to treat it with medication first. So did they try medication first with you?
So they did. So they wanted to put me on, a beta blocker and a calcium channel blocker. The cardiologist did. And what's kind of crazy is I'm allergic to several beta blockers and channel blockers. But generally they'll use a medicine first called metoprolol, which it has a long-standing history of treating arrhythmia problems. And so they went ahead and prescribed the metoprolol before I left the ER. And the next day I was to follow up with my cardiologist.
Okay, and you went to the cardiologist, and what did he say there?
I went to the cardiologist and put an EKG on me, and thankfully my arrhythmia had settled down. And so he said, let's do the metoprolol for a while, and then we will, bring you back in about a week to check on everything. The other thing he was going to do is he looked at the blood work that I had done in the ER, and my cholesterol was great. My electrolytes were great, which he said could sometimes cause a fast heartbeat. And so he eliminated those factors from being issues. But then he scheduled what's called a heart CTA, which is they give you a dye contrast and they run you through a CT machine, and they look to see how much calcium you might have built up, which would indicate a blockage of some sort.
So again, and what you guys may or may not figure out is no medical journey with Bonnie is a straight line, and it's usually not normal.
Unfortunately.
So you go in, and he did the CTA, found out that there really wasn't an issue with blockage.
Yeah, I had 0 calcium.
So where did he go from here? Is that when they kind of figured out that this was a little bit of an anomaly, or where'd they go from there?
So, since he could not find the cause, he referred me to Dr. Tom Wallace, which is an electrophysiologist. So the cool thing about an electrophysiologist is they deal with the electricity in the heart and not the plumbing of the heart. And because he felt like it was time to send me over to the electrophysiologist. So I got my appointment. I went in for my appointment. And so Dr. Wallace, he looked at everything, and he decided he wanted to go ahead and do a stress test just to make sure that the stress load on my heart wouldn't indicate a bigger problem. So we moved forward and did a stress test.
Okay, you did the stress test. They found out that the load on your heart was really not the issue, right?
Correct.
So again, not a normal situation necessarily. So where did you go from there? It was a journey. Let me just tell you, it's been a little bit of a journey. So
I will say this journey has lasted now for 1.5 years. And I noticed I immediately had some changes while I was going through this. So I had an allergic reaction to the metoprolol. And I had to go back to the ER for a shot to stop the allergic reaction. And Dr. Wallace put me on a different heart medicine at that time to take twice a day instead of once a day. And that medicine did seem to help. I wasn't having the symptoms as frequently. But when I say from the moment I started having the problems in Walmart, my energy level, I couldn't walk 200 feet without stopping and being out of breath and being super fatigued and feeling very lightheaded. And those are all really scary symptoms when you go from, working out 5 days a week and, being super active. And so it really changed pretty instantaneously my life in a pretty impactful way. So, after the stress test, which I do want to let our viewers know, stress tests are not scary. I know that you hear a lot of horror stories about stress tests, but really it was done in the physician's office.
Right.
And they put you on a treadmill, and they put all these EKG stickers on you, and they slowly get the speed on the treadmill going. I never ran whatsoever, but what it does is it shows them, like I mentioned, the load on your heart.
Yeah. And really, if you're going to have an issue with load on your heart, you want to find out when you're in the physician's office.
You do.
Because they can treat it right away.
Yes.
You don't want to find it when you're out working in the yard or shopping, something like that, when there's nobody there to help you. So that's the good thing about a stress test. Yes,
and there's 2 nurses in with you during the stress test. And so that is in case something happens, they can quickly react. But thankfully, nothing happened. And it actually showed my heart was very strong. And so I went back to see him in a couple of weeks, and I noticed that I started just instantly gaining weight on this new heart medicine. And so I brought those concerns to him because he knew I had lost a lot of weight over the last 5 years. And he decided that heart medicine was not the best fit for me. And I was still having a lot of breakthrough symptoms. So I was still having a lot of issues with my heart flipping and flopping and the feeling of being extremely lightheaded going on. And
yeah, it just goes to show you that medical conditions, especially ones with the heart, are usually not a black and white situation. There's a whole lot of gray in there. So unfortunately, there's sometimes a lot of trial and error to find out exactly what works best, because everybody's different. So you got to find what works best for the individual. And so that's what they were trying to do for you, just find out what worked best for you.
They were. And also too, it's very interesting when you don't fit the regular patient profile, because that is one thing that I did consistently hear when I would go for tests is they would say, oh, you're so young for this kind of a condition, or you don't have any of the factors that we usually see with this kind of condition. But the great thing about that was Dr. Wallace and his team really looked at the symptoms and did not put you in a patient profile. So it really made you feel heard and understood, even though we were still on the journey of trying to figure out what was going on.
Yeah, and they're not going to stop. They're going to keep going until they find out what's wrong and how to fix it.
Listen, I mean, a year and a half later, absolutely. Because just like with that one heart medicine, he changed the heart medicine. And I brought up the video my sister took of the EKG in the emergency room because they put a heart monitor on me in the emergency room and I was highly allergic to it. And so they had me remove it. So they did not get a clear heart monitor reading over an extended period of time. And so I'd mentioned the video to Dr. Wallace and he said, do you still have it? And I said, yes. So I showed him the video of the heart monitor when I was in the emergency room, which actually allowed him to change my medications that affected a different part of the heart that was causing the arrhythmia. And that was something I did not realize, is that not every arrhythmia is the same, and they come from different parts of the heart. So what he found was my arrhythmia is actually coming from the top portion of the heart chambers, the atria, and not the lower chambers, the ventricles.
So you were throwing PACs, not PVCs.
Yes. I was majority throwing PACs. And so he put me on a completely different medication, still twice a day. And I've been on that medication now for about 6.5 months. And we have had to increase the dosage, but I'm feeling probably the best that I have in a year and a half.
It's interesting to know that depending on where the arrhythmia is generated in the heart, that affects what kind of medication they give you and what medication they give you and how they treat it. So that's kind of interesting.
Well, and the great thing too is the new medication also stopped me from gaining weight that the other heart medicine had caused me to do.
Mm-hmm.
And that's the other thing I learned through this journey is a lot of arrhythmia medications can cause fluid retention or some weight gain. And so I've had to be really patient with myself as I've been on this new medicine to slowly try to get the weight that I'd gained off.
Mm-hmm.
But that's hard because,
Yeah.
you know, I don't want to wait long to lose weight.
Well, no, but you have to allow yourself time to get used to the medication and get over it. And so, yeah, maybe you say so.
But, you know, and on the podcast, guys, you know, I say this all the time. We go to Dr. Google,
Mm-hmm.
right?
Mm-hmm.
I did. I went to Dr.
Even
Google.
though you know better.
I know better. But what that also did, though, was, again, I stuck to reputable websites like Mayo Clinic, Cleveland Clinic, and the Heart Association to just educate myself on arrhythmias, because so many people think that arrhythmia issues is just AFib. And what I've learned is it's not just AFib. AFib is the one you hear most about.
Right.
But you can have so many arrhythmia problems
Mm-hmm.
that have not turned into AFib.
Yeah.
Which I didn't know.
Yeah. And, you know, that's a good point when you talk about when you search for medical information online is we don't want to say don't ever do that because there is good information out there.
Yeah.
Just don't let that be the only advice that you get.
Yeah.
Use that as a tool to learn more so that you have more information to talk to your doctor about. But don't let it end there. You can start it there, don't let it end there.
Absolutely. And, you know, the other thing, too, that can help is with the symptoms is just I had to notice what kind of triggered my symptoms to be worse, such as stress. Even if I don't feel stressed, if I'm in a stressful situation or a tense situation, I do notice that I tend to be more symptomatic. And it kind of triggers the symptoms for the rest of the day,
Yeah.
which is interesting. But hydration, too, is so important when you have arrhythmia issues, is you have to stay hydrated because that can also affect how often you feel the symptoms.
Yeah. And it's important too, like you said, you know, you were really cognizant and you paid attention to how you were feeling and what triggered you to have episodes
Mm-hmm.
and how the different medications made you feel. Even if it was a small thing, you knew that was important to bring up to your cardiologist and say, look, it's better, but, you know, I'm still having this issue, or, you know, I really don't like the way it makes me feel here, or I noticed when I'm doing this, it seems to be worse.
Yeah.
So it's always good to pay attention to your body. You know your body better than anybody. So pay attention to your body and make sure you give all that information to the doctor because that's all helpful for them.
Yeah. And no weight gain. Because one of the things that really early on when I was on the medication that made me gain weight, the trigger for me to notice that were my shoes. Because I noticed at the end of the day, I could not fit in my shoes. My feet were so swollen that I would have shoe marks on and around my toes. And that is what made me stop to say, okay, I've never had this issue before. This isn't working for me.
Don't mess with Bonnie's shoes, y'all.
No, don't mess with the shoes. But, you know, it would make my feet hurt.
Yeah.
Like, because the fluid was just sitting there. It would just make my feet hurt.
Well, that's interesting because fluid retention, that makes sense because gravity would pull it down. And that's where you're going to notice it first is in the lower extremities down by your feet.
My little toes looked like little piggies. Like,
Your little piggies were little piggies.
They were they were going wee, wee, wee all the way home.
So take us so now you've been on that new medication for 6.5 months or so. How are you doing now?
I feel really great. My energy is definitely much more back in line with where it was. That is, though, a common side effect of arrhythmia issues is you do struggle with fatigue. So some days I feel absolutely normal. Some days I do struggle a little bit with a feeling of tiredness.
I think all of us could say that.
Yeah. It's like, is it or isn't it?
Yeah.
But the great thing is I'm back to my workout routines. I mean, just last night I walked 3.5 miles, which I would not have been able to do before. And I'm not non-symptomatic, but they're definitely more controlled than they were before.
So for now, is it continue on as you are and wait and see if things hold steady, or what's
it is. Yeah. So I just completed a 30-day heart monitor wearing, and
she wasn't allergic to this one, thankfully.
Well,
not the first.
Not the first.
The first one she was allergic to. The second one she was not.
So here is the thing, though, guys. If you have an adhesive allergy or a Band-Aid allergy, tell your doctor if they want you to wear a heart monitor, because there are this different monitor that you can wear that has little hypoallergenic gel probes instead of sticker probes that do not react. So I want to say, if you do have an allergy to any adhesives or Band-Aids or anything like that, let your doctor know, because there are options. I learned that one too, the hard way. Yeah, and I got my results, and the good thing is the medication is controlling my symptoms for the most part. It showed that I do still have some symptoms, but they look at the average and the load on your heart that I mentioned earlier. And the good thing is it indicated that my heart is strong. And at this point, I don't need an ablation or anything like that yet.
Yeah. So that would have been the next step, I guess, if the medication hadn't proved successful, is they would have done an ablation.
Yes. So they can, at some point, he said, I will probably likely have to have an ablation procedure. But they want to utilize all the medication options first, especially since I don't fit the normal patient profile. They want to use medication therapies as much as they can.
Yeah. And just for you out there, an ablation procedure, they actually go in and use an energy source to stop the heart throwing those extra electrical impulses that cause your heart to beat irregularly. So they can go in there and actually use an energy force to stop those areas so that your heart beats more on a regular rhythm. So
yeah, it's really cool too, because really, it really takes you just a couple days to recover, but you feel the results of an ablation right away. And they go in through a catheter through your groin or your wrist. So there's no incisions that have to be done, and they just scar the portion of the heart that is causing the electrical abnormality, and then you're good to go.
Yeah.
Yeah. But thankfully not there yet.
Yeah.
Just taking pills twice a day.
There you go. Well, we're glad that things are working out for you. We know it's been kind of a journey for you.
Yeah.
But you're on the right track, so we're good. And like Bonnie usually says on these, that's why it's so important to pay attention, because if something feels like it's not right, it's probably not right, and you need to get it checked out.
You did a good job, Danny, on that.
Thanks. I appreciate it. I've only heard you say it a couple times. Well, appreciate you, allowing yourself to swap chairs and change hats here and pull me from back behind the camera. So we appreciate you coming out. And guys, like Bonnie always says also, not sure what we're going to talk about next month, but it's going to be some information that you're going to want to tune in for. So we hope you join us next month for our podcast, A View from the Bed.
Yeah. Bye, guys.
Thanks for joining us for today's episode of A View from the Bed, A Patient's Perspective. We hope that you found it helpful. We hope that it helped you make your healthcare decisions. We hope that it made you feel a little more comfortable with your own journey. And we hope that you'll join us next time.